assigned to me for my presentation. The topic that has been assigned to me for my presentation is the drug which is known as betamethasone. And before heading towards the main topic that I have to main topics that I have to cover for this drug, I would like to give some basic introduction related to this drug. This drug basically belongs to the class of topical corticosteroids and has an anti-inflammatory effects, and it reduces its effect by reducing the body's immune response. It basically binds to the receptors in the cytoplasm to form a complex that enters the nucleus and binds to DNA. And this complex then regulates the gene expression by modulating the transcription of messenger RNA, ultimately decreases the expression of the pro-inflammatory mediators such as interleukin 1, 2, 6, and the proteins such as interferon alpha, and resulting in the reduced redness, swelling, and irritation of the skin. Uh, this drug is basically, we can say that it is immunosuppressant, so it is used for the wide variety of the autoimmune disorders, but today uh, on the my focus would be on the skin conditions and the treatment by this drug. Available, like anywhere. Talking about its dosing, in adult dosing or usual adult dose, I have mentioned two of the conditions. I have already mentioned that they are used for wide variety of conditions, but my focus would be on skin conditions. So there are two skin conditions, that is for dermatitis and another for the plaque psoriasis. For dermatitis, cream, gel, ointments are applied on a thin film topically to the affected area 1 or 2 times a day, and they're also available in the lotion form, and uh, they're applied topically twice a day, morning and the night. Same goes for the plaque psoriasis. They are applied to the affected area of the skin twice a day, and we should rub it gently since our skin's barrier is already very disturbed. So we shouldn't put them in harsh manner. And the duration of treatment for the use of the plaque psoriasis is up to 4 weeks. The for our pediatric dose, I have mentioned the condition dermatitis, and it is used for the patient that is 12 years or older, and it is available in the form of cream, gel, and ointments, and we apply a thin film topically to the affected area 1 or 2 times a day, and it is in the lotion form. It is applied topically twice a day. That's in the morning or in the night. Talking about the drug interaction. Okay, so first drug we have is aminoglutamide. This drug is basically an adrenocorticosteroid synthesis inhibitor, which is used in the treatment of Cushing syndrome. First of all, we have to understand this fact that the drug interactions as well as side effects, since we are applying this drug tropically, so they occur because of the systemic absorption of this drug, and systemic absorptions occur frequently. Why? Because the skin barrier is already very disturbed. So there is a chance that if you are taking another medication, you should consult your doctor or pharmacist first before taking or applying this topical corticosteroids. Or mention the use of these drugs too, that that you are using these drugs, so they would suggest you the proper treatment methodology. So talking about the first drug we have is aminoglutamide. It belongs to the adrenal corticosynthesase inhibitor. So it would, if the drug gets absorbed systemically, so it's, we can say that there aren't any chances of the appearance of systemic side effect. Because why? Because this drug ultimately reduces the synthesis of the inhibits this inhibits the we can say the it basically reduces the bioavailability of the corticosteroids. Other drug we have is oral anticoagulants. So again, oral anticoagulants and the systemic availability of the topical betamethasone, if gets absorbed systemically into the blood, they reduce the bioavailability of the drug. Anti-diabetics, major interaction. Why? Because if you are taking any agent that is a hypoglycemic agent, and which is using for the raised blood sugar level, or you are and the person is diabetic, so higher dose of corticosteroid can cause the patient to take some insulin too, to take their blood glucose until that steroids are ceased. because what they will do, they will cause the reduced bioavailability of the anti-diabetics and can cause the hyperglycemia in that patient. Okay, the next drug we have is cholestyramine. Drug interaction, cholestyramine basically increase the excretion rate of the betamethasone and can cause a lower serum level, and obviously potential in the reduction uh, in the activity it produces systemically. The last but not least and the major drug interaction that take place between the amphotericin B injection, like the first of all talking about the amphotericin B, it is an antifungal drug, and if it is given to the patient intravenously, and also the betamethasone is applied topically, and if it gets absorbed systemically, then a major and a serious drug interaction occur, and the medication may interact and cause very harmful effects. So in that case, contact your healthcare professional for more information, because when you take these medications together, your body may not process potassium properly, and the amount of potassium in your blood may decrease and cause some serious side effects such as an irregular heartbeat, confusion, muscle weakness, discomfort, increased urination, increased thirst, or increased hunger. Okay, drug toxicity. As I have told you, occur that the toxicity, because our focus is to apply the drug topically, so the drug interaction as well as the toxicity would occur if the drug gets absorbed systemically. So they are known to cause many systemic side effects when they are administered or applied. Okay, so what they basically do, they are the I have already mentioned that these drugs are the very potent ones. That's why they are categorized into 7 classes according to their potency, and their categorization is based on the vasoconstrictive property. And the goal of the topical steroid is to deliver the therapeutically effective dosage of the drug to the target area. And the possibility that these drugs could be percutaneously absorbed is considered soon after they come into use. In the slide, I have mentioned that the topically applied betamethasone for actinic keratosis may trigger systemic side effects. Systemic side effects of the topical betamethasone may completely resolve after the discontinuation of the causative agent, and the patient with scalp actinic keratosis develop fatigue and the need to sleep shortly after starting topical betamethasone diclofenac ointment. Additionally, he experienced vertigo, nausea, sleep disturbance, change in character and recognition, tiredness, visual impairment, and elevated blood pressure. Since all the symptoms resolved completely within 48 hours after discontinuation of the ointment, they are attributed to glucocorticoids. But first, we should know that we are basically applying this condition in case of skin diseases, and this is also the thing that we know that in case of skin diseases, our skin barrier already gets disturbed. The stratum corneal, which acts as a barrier for the percutaneous absorption of the drug into systemic circulation. In case of diseased skin, it already has impaired barrier function, resulting in the enhanced absorption of this drug into the system. Blood. The horny layer, we have also know that there is also a skin layer. It also serves as a reservoir from which the drug penetration in the body continues even after a single application. Therefore, even the small doses of the potent topical steroids can produce systemic side effects like the suppression of hypothalamic pituitary adrenal axis, iatrogenic Cushing syndrome, and the growth retardation in children. But the chances of these severe side effects to happen are very rare, and most they are usually occur in children and in elderly patients. Talking about the alternatives, as we know that the betamethasone among the topical corticosteroid is the most potent one. That's why when we treat the patient, or we manage the disease condition of the patient, we should start with the less potent one. And if the condition, if it's not getting treated properly, or the condition is getting deteriorated rather than improving, then we basically proceed to the most potent one. So we will basically start with the less potent one. So why? Because the less potent one has the less chance to cause the systemic side effects. So the best alternative is the hydrocortisone, and as mentioned in the slide, that topical corticosteroids are available over the counter but of only mild potency. Example, hydrocortisone cream. So this only attributes to the fact that it is available over the counter. Betamethasone cream is a potent corticosteroid, so it is restricted to prescription only to ensure that is used safely and appropriately. Okay, one more thing, just because that hydrocortisone cream is applied over the counter and you can easily purchase the drug, doesn't mean that you should use this without the doctor's prescription. Just because less potent, because all of the corticosteroids has a tendency to produce side effect, but less potent means less side effect. But again, the usage should be in accordance with the physician or pharmacist guideline. Here I have mentioned two or three basically available preparations that we have for the hydrocortisone cream. Hydrocortisone 2.5%, which is available in the form of cream and lotion. Hydrocortisone 1%, which is over the counter brand of creams, ointment, lotion. Hydrocortisone acetate, which is available in the form of cream, 0.5% and 1%. So the case here, we have a case study related to this. uh, Talking about the assessment management, I would like to talk about the disease, uh, that is ectopic eczema. This Because the pathophysiology should be known before treating any of the disease. uh, okay, so this is basically a condition in which there is marked itchiness due to in which there is marked itchiness and inflammation occurs. It is a chronic disease of the skin based on the skin barrier dysfunction, which leads together with the environmental factor and multiple changes of the immune system, causing the itchy lesions and other typical disturbances that is very bothersome and painful for the patient too. So subject includes the chief complaint. Chief complaint is the dry rash, widespread dry rash, sleep disturbance due to the itchiness at night time. History is that clinically diagnosed non-atopic eczema, and the medication that he is on right now are the oral antibiotics for the presumed bacterial infection and the hydrocortisone 1%. For objectives, we don't have any data provided here. So the assessment, by looking at the condition, or by judging at the condition of the skin, we can see that the person has ill-defined dry erythematous patches of eczema, basically shows the secondary infection, that the infection has gotten worse since it's not getting treated by the previously prescribed medicines. So now we have to change the medication. First of all, we have to switch to regular emollient therapy, and emphasis should be put on the correct quantity, correct use, correct frequency, correct time. uh, and the next thing we would prescribe, that is the slightly potent topical steroid other than hydrocortisone. Since the person is not getting treated with the hydrocortisone, so now we would suggest this person potent steroid, then the previously prescribed one, which is betamethasone, and it should be applied but with medical care, keeping in mind the side effect that this drug can cause. So this is all we have regarding or related to our drug. Now I will start my presentation over here. Here are the references that we have that I have used for the whole presentation stuff. I hope so I have done my part. uh, Thank you so much. Now I am ending my presentation here. Thank you. Allah Hafiz.